Welcome to an exploration of drug metabolism, one of the most fascinating chapters of pharmacokinetics. Drug metabolism, also called biotransformation, is the process by which the body converts one chemical entity into another using specific enzymes. This conversion produces metabolites that may have decreased, increased, or similar activity compared to the parent drug. Ultimately, metabolism serves as the body's detoxification system, preparing drugs for elimination. The core purpose is simple yet elegant. Lipophilic, fat-loving drugs are transformed into water-soluble polar compounds. Why? Because polar molecules are eliminated from the body far more easily than nonpolar ones. This transformation primarily occurs in the liver, the body's master chemical factory, ensuring that drugs do not accumulate and cause toxicity. Now let's look at a remarkable phenomenon called enterohepatic circulation. After oral administration, drugs travel from the small intestine to the liver. Some are secreted into bile as conjugates and re-enter the intestine. There, bacterial enzymes deconjugate them, releasing the active drug, which is reabsorbed back into the bloodstream and returned to the liver. This cycle repeats, prolonging the half-life and pharmacological effect of drugs like steroid hormones, chloramphenicol, vitamin B12, vitamin D3, and folic acid. However, this circulation can be reduced by certain antibiotics that kill gut bacteria, or by ion exchange resins like cholestyramine that trap drugs in the intestine. Drug metabolism unfolds in two phases. Phase 1 reactions introduce or unmask polar functional groups, increasing water solubility. The three main types are oxidation, reduction, and hydrolysis. Oxidation is the most important, catalyzed by the famous cytochrome P450 enzymes located in liver microsomes. These mixed-function oxidases use molecular oxygen and NADPH to add hydroxyl groups to drugs. Non-microsomal oxidation, handled by enzymes like monoamine oxidase, processes catecholamines and alcohol. Reduction reactions add hydrogen or electrons, while hydrolysis cleaves esters and amines using carboxyl esterases and amidases. Phase 2 reactions are conjugation reactions, synthetic processes where the drug or its phase 1 metabolite is joined with an endogenous molecule to form a highly polar, easily excretable conjugate. Glucuronidation is the most common, catalyzed by UDP glucuronylyl transferase. Other pathways include sulfation by sulfotransferases, methylation by methyltransferases, acetylation by N-acetyltransferase, and conjugation with amino acids or glutathione. Interestingly, some conjugates retain activity. Morphine 6-glucuronide is actually more potent than morphine itself. Enzyme activity can be modulated. Enzyme induction is the process where drug-metabolizing enzymes are increased by drugs, pesticides, or polycyclic aromatic hydrocarbons. Inducers like phenobarbital boost CYP450 activity, accelerating metabolism and reducing the duration of drug action. A classic example, phenobarbital reduces the anticoagulant effect of warfarin, increasing thrombosis risk. Induction can also enhance toxicity by producing reactive, carcinogenic intermediates. The opposite is enzyme inhibition, where enzyme activity is decreased, causing drug accumulation and prolonged action. Direct inhibition can be competitive, like methacholine competing with acetylcholine for cholinesterase, or non-competitive, as when isoniazid inhibits phenytoin metabolism. Indirect inhibition occurs through repression of enzyme synthesis or altered physiology. Notable inhibitors include allopurinol, which blocks xanthine oxidase, and disulfiram, which inhibits aldehyde dehydrogenase, causing alcohol intolerance. Many factors influence drug metabolism. Age matters. Neonates have underdeveloped enzymes, so caffeine's half-life is 4 days in newborns versus 4 hours in adults. In the elderly, reduced liver size and blood flow slow metabolism. Sex differences, dietary protein and vitamins, liver and kidney diseases, hormones, and pregnancy all alter enzyme efficiency. During pregnancy, high steroidal hormone levels slow phase 1 and phase 2 reactions. Understanding these variables is essential for safe, personalized drug therapy. Drug metabolism is the bridge between drug action and elimination, a finely tuned biochemical symphony performed mostly by the liver. From phase 1 oxidation to phase 2 conjugation, from enterohepatic recycling to enzyme induction and inhibition, every step shapes how a drug behaves in the body. Master these principles, and you master the heart of pharmacokinetics. Thank you for watching.